Right now in our country, we are facing a very serious health crisis. And the crisis is affecting many, many people in our country, most of whom are, frankly, silently suffering. After the United States Supreme Court took a constitutional right that had been recognized from the people of America, from the women of America, in states around our country, extremists have proposed and passed laws that have denied women access to reproductive health care. And the stories abound. I have heard stories of, and have met with women who had miscarriages in toilets, women who were being denied emergency care because the healthcare providers there at an emergency room were afraid that because of the laws in their state that they could be criminalized, sent to prison for providing health care. So I'm here at this healthcare clinic to uplift the work that is happening in Minnesota as an example of what true leadership looks like, which is to understand it is only right and fair that people have access to the health care they need, and that they have access to health care in an environment where they are treated with dignity and respect. And please do understand that when we talk about a clinic such as this, it is absolutely about health care and reproductive health care. So everyone get ready for the language. Uterus. That part of the body needs a lot of medical care from time to time. Issues like fibroids. We can handle this. Breast cancer screenings. Contraceptive care. That is the kind of work that happens here, in addition, of course, to abortion care. So to have laws in states that have caused clinics like this to shut down so that women have no access within any reasonable distance of where they live to get this vital care that is necessary to address their health needs and concerns. So again, I say thank you to the governor, the congresswoman, the mayor, and the doctor, and all those who work here, and the staff. This work includes having people here who go out and talk to young people, our young people in high schools. And sadly, in so many places around our country, sex ed is a thing of the past, which leaves our young people to learn about their bodies and reproductive systems on social media, often with a profound amount of misinformation which leaves them confused about what is happening to their own bodies. The work that happens here is about providing assistance to women who do not live in the state of Minnesota, because sadly, this state exists in a neighborhood where laws have been passed to deny people reproductive health care, and so women have to travel here. You know, the majority of women who receive an abortion are mothers. God help her that she's got affordable child care. If she is working, God help her, she's got paid family leave. So she can figure out how is she going to get to the place that will provide her the care she needs. Well, the work that happens in a clinic like this includes answering those questions for someone who might be in great distress, letting her know what is available to her in terms of transportation, in terms of housing or hotel, what is available to her in terms of assistance for her child care needs. So I'll close with this. In this environment, these attacks against an individual's right to make decisions about their own body are outrageous and in many instances just plain old immoral. How dare these elected leaders believe they are in a better position to tell women what they need, to tell women what is in their best interest. We have to be a nation that trusts women. And with that, I will introduce this extraordinary healthcare provider. And doctor, please.
Thank you. I am a proud abortion provider, and I'm honored that Vice President Kamala Harris has visited our clinic today. It's a historic moment, and one that demonstrates how critically important access to reproductive health care is to people and their families across the country. So thank you so much for being here today.
Thank you.
Thank you. After the Dobbs decision a year and a half ago, Minnesota has become a bastion of access for abortion care. But abortion rights are not only a Minnesota issue, it is a national issue. Our Planned Parenthood has seen a 25% increase in abortions here in Minnesota since Roe was overturned. We've seen nearly 100% increase in patients coming here from outside of our state. This is not by accident. Surrounding states have been limiting and banning abortion, while Minnesota, with the help of our governor, has been increasing access. Since Roe was overturned, I've cared for patients from everywhere, from nearby states like South Dakota and North Dakota and Wisconsin, but from faraway states like Texas, Alabama, Wyoming, Florida, Oklahoma, Missouri, and the list goes on. I've seen patients who've flown from places like Louisiana only to have me tell her that her complex pregnancy condition would keep her from having her abortion here with me, forcing her to continue a dangerous pregnancy because hospital-based care was not available to her in her home state. Traveling to access essential health care can be intimidating and overwhelming. It is not an easy thing to do, as we have all pretended that it is. Like the experience of our patient who traveled from a small rural town and became lost in downtown Minneapolis with a dead cell phone after her flight landed. We were able to get her a Lyft driver, our patient navigators, and she described that Lyft driver as a savior for her. And like our patient, who drove hundreds and hundreds of miles through blizzard conditions just to get her abortion. Our new abortion landscape is difficult. It is dangerous, and it is putting my patients and healthcare providers at severe risk. I've talked to my colleagues practicing in states where abortion is now illegal, and they are unnecessarily struggling with decisions around providing ethical, proper medical care and conflicting with the law. This should never happen. Thankfully, providing abortion care has gotten less complicated in Minnesota. Here, I'm trusted as a provider and an expert to work with my patients to provide the best care possible. To know that I'm trusted to do my job is a comfort to me, but it should be the standard everywhere. Private medical decisions should be made between patients and their doctors, without interference from politicians or the protesters standing outside on the street in front of our clinic today. Everyone should have the right to access health care. Your zip code shouldn't dictate the care that you can access, your race, your socioeconomic status. None of that should determine it. So in 2024 and beyond, we will keep fighting, we will keep working until we live in a world where everyone can access the care they decide is best for their futures and their bodies and in their own community. Thank you.